So here we have a left leg, and we're seeing the tibia and the fibula, which is our lateral bone. And we're going to have a look at the tendons that form the lateral group of the ankle. So there's two main tendons to know that form the lateral group, and they're named after the fibula, so we call them the peroneus something. So to distinguish the two different tendons, we have a longus and a brevis, and obviously longus implies that it's a much longer tendon. So the longus is the first tendon to be seen immediately sort of posterolateral to the lateral malleolus. So here's our lateral malleolus. So this would be peroneus longus. Its origin is up here on the superior 2/3 of your lateral surface of the fibula, and also attaches to the lateral head, and some of the fibres may extend over the joint to lateral condyle. So here's where peroneus longus begins. And then where does it terminate? So what's its distal insertion? So to see the distal insertion, we would actually need to rotate the foot over, because this tendon passes underneath the foot and all the way over to the first metatarsal. So this is our first metatarsal. So on the undersurface of our metatarsal, you can see a little blue mark, and that's where the longus inserts. So peroneus longus, while it's a lateral tendon, it actually ends up medially on the foot. So it ends up like this. And the peroneus brevis implies that it's shorter, but it's also slightly fatter. And at the lateral malleolar level, it actually is sort of placed slightly posterior and underneath the longus. So you'll see the muscular portion of the brevis extending either side of the longus tendon, which appears more like a white, long, slender tendon at this distal fibula. So the brevis has its origin on the lower 2/3 of the lateral surface of the fibula. So brevis would be coming from here. And then where is its distal termination? So you can see how it sort of crosses over the longus tendon at this point, and it inserts on this. See, there's like a dorsal tuberosity of the 5th metatarsal. So this is where the tendon inserts. So you can see it has a much shorter course than the longus. It doesn't extend as far. So I'll just set them up so you can see how they're placed. In terms of their relational anatomy, we would say that the longus is probably the first tendon you see passing behind the lateral malleolus, and the brevis would be the second tendon. And then at this level they intersect, they cross over one another. So the longus ends up going deep to the arch of the foot, and that's why it actually helps hold up the arch of the foot. Whereas the brevis, you can see it terminating here on the 5th metatarsal base. So there are straps that anchor these peroneal tendons in, and they can be damaged. And there's two retinaculum. There's a superior retinaculum, which can be located sort of anywhere near the lateral malleolus, but also slightly above. So there would be a peroneal retinaculum there that helps to stabilize it. And there's also another peroneal retinaculum, or two, which are like little straps that anchor the peroneal tendons in at this level. So if those straps are damaged, it can allow for excess movement of the peroneal tendons, and as they sublux around, meaning move out of their usual position, if this retinaculum is damaged, it can cause the tendon to even sublux anterior to the lateral malleolus. And over time, that friction can produce tendinitis. And tendinitis of these tendons implies they're painful, which is a clinical diagnosis. But when they're actually looking degenerative and a little worse for wear because of all that friction, we say peroneal tendinopathy, or we say peroneal tenosynovitis. And tenosynovitis means we see some damage and changes to the tendon, as well as synovial thickening, which implies there's excess fluid in the sheath of those tendons. So let's just revise. So we have two lateral tendons. We have the peroneus brevis, which has its origin on the lower 2/3 of the lateral surface of the fibula. We have the peroneus longus, which has its origin in the upper 2/3 of the lateral surface of the fibula and also the fibula head and neck, which is where our common peroneal nerve passes. So the good news is the common peroneal nerve is the nerve that supplies these two tendons. And we said that the longus distally had its insertion all the way over onto the base of the first metatarsal. You can see it there. So there is a third peroneal tendon, just to confuse things, but it's actually not part of the lateral group of the ankle. So it's part of the anterior group, but it is named peroneus something, so we do have to include it in the peroneal group, even though it's not part of the lateral group. So peroneus tertius, if you think tertiary education, tertius implies third, and it's very small, and because it's part of the anterior group, it has its origin more on the anterior surface of this distal fibula, and it actually inserts onto the same bone as peroneus brevis, but slightly more anteriorly. So you can see peroneus tertius inserting onto the base of the fifth metatarsal, but quite dorsally. But remember, it's part of the anterior group, not the lateral group.